Hi, everyone. I'm Catherine Anaya, and welcome to Conversations with Catherine. I am very happy to have with me Armando Contreras. He is the president and CEO of United Cerebral Palsy, which has 63 affiliate organizations nationwide. And I, Armando, have been fortunate enough to know you for several years, but also to work with UCP of Central Arizona and witness the incredible work that you all do for persons with disabilities and, of course, their families. So it's great to talk to you.
Thanks, Catherine, and I'm honored to be on your show. And you've always been a great supporter of many, many charities in Arizona, and especially United Cerebral Palsy of Central Arizona. That used to be my former home, and now I'm with the UCP National in Washington D.C., but still live here in Phoenix.
Yes, so I'm happy to talk to you as you are at home, working from home, just like I am. But there's a lot still going on. And I want to talk about how the COVID crisis is impacting the disability community. UCP recently joined a local and nationwide coalition of advocacy groups to call on Arizona to modify segments of the crisis standards of care to ensure that there is a non-discriminatory denial of life-saving healthcare for people with disabilities, the elderly, and other vulnerable populations. Can you describe for me what those standards include, or kind of a synopsis of what they mean?
Yeah, well, first, we are supporting the Arizona Center for Disabilities Law because they're the one that filed a formal complaint with the federal government. And what happens around the nation is that each state has these standards of care, crisis standards of care policies. And in those policies, basically what it means is that if a hospital does not have any more life-saving equipment, like ventilators, for example, and they're maxed out, then they have to go through a process. And all of the states have a particular standard of care policy. What we're seeing at United Cerebral Palsy and other advocates are saying, please review your policies statewide to make sure that you're not ignoring people with disabilities and not taking a look at people with disabilities at a glance and saying, well, while the policy perhaps may not focus on people with disabilities, and they may not even have a mention of people with disabilities, that means that they can be placed lower on the list for consideration for life-saving type of equipment. And all we're saying is this, is that language in there should be very clear, and that people with disabilities should not be ignored, or there shouldn't be an assumption that their lifespan is shorter than others. So that's why we thought it was very important for us to get this press release out. What's happening here locally is that the ACDL met with Governor Ducey's staff, and perhaps with Governor Ducey, I'm not sure, but they only asked that they can go ahead and update some of the language in Arizona's crisis standard of care guidelines to reflect more and to really speak to that people with disabilities are really embraced during the process. And that's basically what it was. Now, there are other states like New Jersey, and I believe even Chicago, that have updated, and many other states have updated their crisis standards of policy. God forbid that we have to go through that, but just about 2 weeks ago, right, Catherine? We started to see the numbers kind of go up, where there was like 85% capacity, getting closer to 90%. What I understand is that there's some leveling off right now, a slight leveling off, and that hospitals are probably at 85%. But once they hit a certain number, they're going to have to activate these committees, whatever they're called, if they're ethics committees or whatever that might be, is that they're going to have to follow some guidelines. And all we're saying is that to make sure that people with disabilities are considered at the top for life-saving type of equipment during this.
So is the ask then to have an addendum to the policy, an addendum or a change in the language?
Yeah, the ask is, I believe that the Centers for Disability here, the advocacy group, is asking, I believe it's 5 or 6 different additions, language that it's a lot clearer than what they currently have right now. And in
so,
go ahead. Yeah, and in the press release, I think we line We line out all of and we list what those requests are. And I also believe that we have a link in there that kind of um, articulates what the ask is to Governor Ducey's office.
And so what has the response been from the governor and from state leaders regarding this request?
Well, according to the Arizona Center for Disability Law, and this was over about a week ago since we sent out the press releases, that they had some in-person meetings, but the follow-up, they were still waiting for some kind of a follow-up and a deeper discussion. And as far as I know, and this is a few days ago, that had not happened yet.
So what happens if these changes are not made? Well, what is the fear at that point?
Yeah,
because I know it's been a couple of weeks since all of this started, gaining momentum.
Right. Well, the risk is that people with disabilities may be listed maybe at the lower end of a priority list, and that's what we're just trying to avoid. They may be listed, so that's the risk that may happen, which can happen prolonged type of emergency services, or to the extreme, and God forbid, it would be maybe somebody losing their life.
Mm-hmm. To your knowledge, have any families that you know of been in those situations where it has been a very big concern about how they're being treated or where they're being placed in the lineup, so to speak?
My understanding is that particular guideline has been activated, but they haven't implemented it yet. So to my knowledge, I don't know personally of a family that has gone through it, or that any hospital has actually began to do some kind of a selection. I don't think that has happened yet, because it hasn't reached the maximum where there are no more ventilators or no more beds or other equipment. I think Arizona has kind of kept it really close, that it's been right in that mid 85%.
But again, you're trying to get out in front of the issue so that we don't reach a point where we are dealing with families encountering this situation. I read that Arizona is believed to be the only state to give hospitals the authority to implement those standards. Is that correct? And why would that be?
Yeah, well, here's what I understand. I understand that Arizona activated the standards, crisis standards of care, so that in the case they reach that level of capacity, then they can move forward. But all states have the crisis standards of care, and each state has their own language in there. So as far as I know, and as far as what I've learned here in Arizona, there hasn't been any implementation as of yet, because there are still ventilators available and other emergency equipment.
Right.
But like you said, it is a concern because we don't know what the fall's going to bring, right? We thought that COVID was going to die during the summer, especially here in Arizona. That 116 degrees that we've experienced not too long ago, that was going to eradicate COVID, right? I mean, that was really the thought of some people and some of the public officials and maybe some of the public. That did not happen. So then what's in store for the fall prior to having some kind of a solution that may come through medicine, right? A vaccination. What's going to happen in the interim? So we do have to be prepared.
Right. And it's such a fluid situation, as we were discussing off camera. So what is the next course of action then if you don't get a timely response from the governor?
Well, the ACDL, the one that's in front of all of this, they're the ones that are hoping that perhaps through the complaint that they made through the federal government, and I think it's HHS, is that maybe there might be some kind of a response. So that's the hope, and that the language is going to be then updated. So that way they would really take into consideration in a concerted way people with disabilities and our community here.
Well, talk to me a little bit about, because I know we're all challenged on some level by this and by what's happening, but what kind of a challenge does this pandemic situation place on people with disabilities and their families?
Yeah, there are several situations here. I mean, one, the fact that some, not all, may be living in a group home, in a group home setting, where they are placing a lot of the precautions for this virus not to spread. They may be isolated in the room. They could be isolated in the room for hours, right? And for a person with disabilities, and even a typical person, being isolated is not a good thing. In addition to that, they're accustomed, and we're all accustomed to activities. If it's going to be transportation, if they're going to have field trips, if they're going on some kind of an outing, they need to get out like everybody else. They're no different. And being isolated, again, can really cause some major issues, and that could be psychological issues. In addition to that, some, not all, but frequently go get medical care, and transportation now has been an issue. And then if you go to a medical facility, you'll know that there are certain restrictions in there, and you may not easily be ready to, or get in, have that access. In other situations, if they happen to go to the hospital because they have the virus, then, as you know, there's been many stories, and it's still today, that family members cannot visit a family if they have COVID. Well, it's really difficult for people with disabilities that need additional care from their family members or support professionals that provide this ongoing service, and they're not allowed to go into the hospitals. So there's also policies in there that really are not enhancing those personal needs that people with disabilities have. And then in addition to that, today, which is a good thing, I think it replaces, at least for now, and it's safe, that you've heard like teletherapy, where you have a therapist on one end, and then maybe you might have a child with a disability. That's what's happening in many of the UCPs. So I've had conversations with therapists where for now it's a good thing, but it's not the same. It's not the same by holding a child, helping the child walk, or doing particular exercises, especially if you're going to demonstrate to a parent, a mom, a dad, and you're demonstrating something. It's a little bit more difficult when you're doing it through, say, Zoom.
Right.
And you're not interacting with that child. So there are a lot of issues during this time of the virus or pandemic.
Well, your voice is very important. Of course, you've been an advocate for a very long time, but I think it's even more important for you to be out there and talking about how this affects people with disabilities, because you are somebody who has survived COVID. You and your wife were diagnosed not too long ago. How bad did it get?
Yes, I can tell you that. It was Memorial Day weekend, and Norma, my wife, she was feeling like something was coming on, some kind of cold or something, and she checked her temperature, and she was fine. But then that Sunday of Memorial Day weekend, on May 24th, she said, "I think I have a fever." So she checked it. Yeah, it was in the like 99 point something. Called our doctor. He said, "Bring her in on Tuesday," because it was Memorial Day weekend, and to do the test, you can actually do the test at the doctor's office, but in order to take that sample to a lab, the lab has to be open. So labs were not open during that weekend. So to make a long story short, then she had the symptoms, had the fever, had the lack of taste, the headaches, fatigue, a lot of muscle aches. The good thing, if there's anything, a silver lining, is that I had an opportunity, because it's just Norma and I here, to help her during the first 5 days. And that's when I started then feeling the aching, the headaches, the fever. The difference between Norma and I, and where it got really scary, is that I started having breathing problems. So that really put a scare on both of us. And it got to the point that maybe I was close to heading to the hospital, but I was in communication with our doctor. And he had kind of said, listen, if you walk and you're feeling this throughout the day, then you have to go to the doctor. But I was feeling the shortness of breath just in the evenings for about 3-4 days. And then everything slowly goes away. And it was the worst 20 days probably in our life.
Wow.
And there was an additional 10 days just to feel better. So, really, as some people consider me as an advocate. I consider other people out there like yourself and many others that are great advocates. But I do have to say is that it's real. It can kill somebody. It's a virus that has to be taken very, very seriously. We were practicing social distancing. We were wearing a mask, and we still got it. And we're still not sure how that all happened. It could have been that we touched the surface or something. We can't figure it out, but we know, and Catherine, people out there that are in the hospital right now, people that unfortunately passed away, it doesn't matter what age they are. There used to be, in March, we were hearing from the CDC that it was the elderly. Now you have children and you have young adults and you have people in their 20s. And I think about a couple of weeks ago or a week ago, the average person that was getting the virus was between like 20 and 30.
Mm-hmm. Well, we need to take this seriously for sure, because, as somebody who's been there, that this is real and it's very frightening. And we all just need to do our best to be part of the solution here. So for people who are watching this and they want to help UCP, help what you do, help on behalf of the efforts that you are trying to do to, to change the language in the current crisis standard of care guidelines, what can they do?
Yeah, well, first and foremost, our website at UCP.org has the various UCPs in the United States. So if somebody's listening out of Arizona or nationally, which I think this goes national, is that you can go to the website and look for the UCP in your state and then support the efforts there. The other is that our local UCP here, which is UCP of Central Arizona in Phoenix, and we also have UCP of Southern Arizona, that you can reach out to them and see what they need. They may need some protective personal equipment. They might need some additional donations because their facilities have shut down for a few months, which means that the reimbursements are not there anymore. Everybody's trying to be creative so they can continue the services that have been around for 70 years, and that people can reach out to the local UCPs to offer, if it's volunteer, if it's donations, if they want to be part of the advocacy, they can also sign on to letters that go out. They can call the ACDL, the Arizona Center for Disabilities Law, and see how they can support them in these efforts. They could write a letter to the governor's office, right? They can contact me if they want. Just go to our website and my number's there.
Armando, thank you so much. I mean, we're talking about, life-saving efforts here and life-changing efforts here. So I certainly appreciate all you have done through the years for persons with disabilities and the community at large, and for sharing your experience. I do not wish that upon anybody. And I'm so, so happy that you and Norma are doing well and you've recovered from this, because it is a scary thing.
Thanks, Catherine. And thank you for actually being that voice out there and having that bandwidth, to get the message out, because you have a lot of great people on your show, great leaders, that have something that can make an impact in people's lives. And that's why we're here for.
Well, thank you, my friend, and continued good health, and fight on.
Fight on.
My fellow Trojan alumni.
Thanks so much for watching Conversations with Catherine. Please remember to hit the subscribe button, like, and comment while you're here. I'll see you next time.